Today we're speaking with Congressman Raul Grijalva, a Democrat representing the 7th District, Arizona. Thank you for joining us, Congressman Grijalva.
Thank you.
Can you begin by telling us about the demographics that you represent?
District 7, it's a border district, about 300 miles of border between U.S. and Mexico. Demographically, it's about 61% minority of color, about 50% being Latino, 8% Native American, and 1 or 2% made up of other minority groups. It's a diverse district. It's a rural district a lot, and it's got big urban center in it. So it's a microcosm, I tell people, of what the rest of this country looks like.
What challenges do Hispanics and Native Americans face when it comes to cancer health disparities?
It is one of the most frustrating health issues that we face in the district and that Native Americans and Latinos face overall. The big challenge is access to health care. The big challenge is prevention and understanding and being educated as to what you can do yourself, particularly with issues like lung cancer and the smoker rate being so high in those communities, and particularly in poor communities. You can tell by the advertising, which always drives me crazy. And I think also the lack of access and the lack of preventive services, I think is one of the things that contributes not only to the high degree and disparity of cancer and on the reservations and among Native people and among Latinos. It's also the fact that because we don't have the access to health care that we should, 28% of Native Americans have no health insurance at all. 31% of Latinos have no access to health insurance at all. And so that just contributes. Then you compound the problem because by the time you do reach this individual, the disease is aggravated, the disease is terminal, and the treatment is expensive, and the quality of life is gone. And so you compound that. And you see it all the time. Indian Health Service tells you about it. And for urban Native Americans, it's even worse. I figure that uninsured rate is up in the 50s. And so that's the legacy. That's the legacy, and it's been there longer than I want to admit, but that's part of the legacy we have in this disparity.
You have long championed access to healthcare services and overcoming barriers to screening and treatment. What are some of your goals?
One of the things that I pushed really hard for during this whole health reform discussion, other than the things that aren't part of it right now, but one of them, we wanted all of Indian health services, Indian health care, to be reauthorized, and it was. That's part of the package. Additional money for prevention, additional money for screening, additional money for community outreach, additional money for disseminating information in a variety of languages. And we also had a significant amount in there for disparity issues, how to close the gap and how to study strategies to help close the gap. And part of it was to build up the professional core, the health care delivery workers to go out into communities and do that, provide incentives for doctors and professionals to go out into communities and do that, to organizations to do that. Very proud of those two components because like it or not, you're not going to deal with this issue of disparity unless you put resources behind it. We can talk ourselves blue about how and wring our hands about the fact that there are disparities, but unless you put resources and a very, very good strategy behind it, you're not going to close that gap.
What do you think is needed to overcome cancer health disparities? You've talked about education.
I think that's fundamental. I think it's fundamental. And, lifestyle issues, overcoming some of the cultural, linguistic barriers that exist, or differences, for lack of a better word. But I think the fundamental issue is education. Once we have laid that foundation, then it becomes a generational, it becomes a family ethic, it becomes a community ethic to deal with the issue and to not only be aware of it, but know about screening, know where to go, and know that it is not an issue that you hide. I mean, great project. We trained women from those neighborhoods, Spanish-speaking ladies, to go and talk to other women about cervical cancer and breast cancer, and bring them out to come and do those tests because they hadn't. As a consequence of that, you discovered cases that you were able to treat women. Otherwise, the disease would have gone unrecognized till you pass that tipping point where it's too late. And those are the kinds of things I mean, that education and using different strategies to close the gap.
What can cancer researchers do to help make this a legislative priority?
Research and development, but particularly research, is one of the huge components that is going to help us close the gap. The availability of treatment, the availability of drugs, the availability of techniques, that comes with research. And that comes with being able to fully fund those kinds of initiatives. But I think what also people, the professional folk and folk that are working on the research, also need to help policymakers understand something in these times, cost benefit. I think a lot can be done to help lawmakers understand that, because everybody's looking at dollar signs right now. Everybody's penny pinching. And so we need to show why this investment in cancer research right now is going to have a dividend of a benefit and a savings of this much down the road. I think that's, unfortunately, we're not just down to talking about science, fact, and science. Money is now an integral part of that discussion. And I think we can prove that an investment now is a huge savings down the road. So I think you can help us with cost-benefit analysis, which has not really been the part of the scientific research, but I think that needs to become a component of it now.
Do you have any words of wisdom for the many advocates and others who are working to eliminate health disparities?
Not to give up. The work that they're doing is part of making this nation secure and strong. It is a mission. It's a calling. My two sisters are in healthcare, nurse and a therapist, and working in communities that are underserved and underrepresented in terms of the professions, and they've taught me not to give up. That this closing of the gap is not an exercise in futility. That as we close it, it makes all the other components of this nation that much stronger. And as we extend the benefit of research, the benefit of treatment, the access to health care to communities that don't have it now, it makes this country stronger and richer for a lot of reasons. And so I think the work that advocates and healthcare delivery folk are doing out there to try to close the disparity gap is one of the most fundamental projects this nation's doing right now. Because as we close that gap, the corresponding benefit to this nation will be huge. And so I would never think about giving up, because their work is recognized, but more importantly, it's a great service to this nation of ours.
Congressman Grijalva, thank you so much.
Thank you so much. Appreciate the time.